Very pleased and very honoured to welcome our keynote speaker, Professor Leo Poon from the University of Hong Kong. Professor Poon is a virologist and a public health scientist who received his doctorate from the University of Oxford. He joined the University of Hong Kong in 2001, and he currently serves as a chair professor and in the School of Public Health, and he's also a co-director of the Hong Kong U Pasteur Research Poll at the University of Hong Kong. So Professor Poon's research primarily focuses on emerging and re-emerging viruses that pose human health concerns, such as SARS and indeed COVID-19, which is, of course, the topic of our conference today. So back in 2003, Professor Poon was among the first to decode the SARS coronavirus sequence. And the identification of the SARS coronavirus in humans and in animals led him to discover many coronaviruses in wildlife, including the first bat coronavirus. During the COVID-19 pandemic, skipping forward quite a bit, Professor Poon made significant contributions to our understanding of the virus and was able to apply these scientific findings to public health practices. And again, very much related to what we've already discussed today in the topic of our conference and our Jean Monnet Centre project, Professor Poon also has a strong interest in research related to vaccinology, right? And we've been discussing the vaccines. So far from more of a social scientific perspective, so it will also be interesting to get the medical science perspective. So Professor Poon's academic and professional accomplishments are far too many for me to list them all. He has published over 300 peer-reviewed articles and is a founding member of the Hong Kong Young Academy of Sciences. In recognition of his contributions to combating emerging infectious diseases, Professor Poon received the highly prestigious Louis Pasteur Bicentenary Prize from the Institut Pasteur in 2023. And he also serves as an advisor on task forces within international organizations such as the WHO. So given his background and his extensive expertise, Professor Poon is, of course, perfectly placed to address us now on the topic of preparing for the next global pandemic, lessons learned so far. And then without further ado, I'll hand over to Professor Poon. Thank you.
Thank you so much. Thanks for inviting me to try to share our own experience with you. Now I'm particularly cautious. Now I'm just a bench scientist. So in the next 45 minutes, I'm just sharing my experience as a scientist who work on the bench and try to use these data to try to make an impact to the community. So I think that which is a good thing. So I can share something which is not another perspective about control in terms of pandemics. And then I hope that we can able to have an opening up a new dialogue for exchanging ideas and how to able to form synergies to try to control the next pandemic. So yeah, purely speaking, I mean, I'm just we'll talk about a lot of scientific findings, and please bear with me on that. Right, so now we have been working on emerging infectious viruses for the past 2 decades. So date back to 97, H5N1 the first case found in Hong Kong, and then SARS, pandemic H1N1, MERS, H7N9, SARS-CoV-2 in 2019. So our team is trying to use multidisciplinary research. So basically, not only about molecular biology, but then a whole bunch of scientific tools to try to work together to try to make an impact to the community. So we have been happily working with different international organizations such as FAO, OIE, and then also World Organization of Animal Health. So I think which is important because what we want to do is try to use these scientific facts and translate it into public health measures. We so-called evidence-based control measures, which is extremely important. I mean, there are a lot of people come up with new control measures. Do they actually work or not? So I think we need to generate scientific evidence to back them up. So now, in the past 20 years, basically, we know that we hear a lot of outbreaks and then also pandemics. Shown in this slide, WHO announced public health emergency of international concern many times. So to us, we have been able to cope with the COVID-19 pandemic and we survive. But it's just a matter of time about the next pandemic. We don't know when, where, and how would it happen. But what we can learn so far is all these outbreaks or major outbreaks and pandemic cause a lot of disruption to the community. So this slide shows about the economical impact, which I will not talk too much about this, but then also social disruptions, mental impact, quality of life, and so on and so forth. So basically all these infectious disease or emerging outbreak actually will affect us a lot. And so I think it's better for us to prepare for it and try to invest on developing some tools to try to mitigate the risk further so that we and our generation can be benefit from these initiatives. So now, as I told you before, I mean, we just don't know when will be the next pandemic. We don't know whether it's a disease X or something that we know before, influenza. You heard about H5N1 in China, Europe, and US, or other animal coronaviruses, which may able to jump into human. Just a couple of months ago, we heard about there is another coronavirus in bat, Hong Kong U5. They may able to have a flat to human. So, I mean, yeah, we just don't know. So I think for my first lesson that I really want to highlight is we really have to do risk management using the One Health concept. So in the context of climate change now, right? That requires different stakeholders to work together, not only academics, public health practitioners, but all bunch of people from different disciplines. They should work together to work as a project to try to understand, to dissect something that we do not know. Right? This slide just show you how little we know about viruses in animal. Right? In the past, at the time when we discovered SARS in 2003, there are not many coronaviruses being known in human. They are at most 3. But now we got more and more, and we know more and more coronaviruses in animals, such as bats. But no, apart from corona, I mean, we don't know much about other animal viruses in the Lech Reservoir. So this is one of the study published 3 years ago, about just sampling animal samples from game animal. So 18 species. And then they try to do sequencing analysis to try to understand what are the viruses that can be found in animal. In fact, they found a lot, right? Now, what I would like to highlight that the ecosystem has been changed a lot. So that has been affected by trading, breeding, climate change. So the interaction between human and animals has been changing a lot, and that creates a lot of opportunity for some of these viruses. To take opportunity to jump into human and cross either sporadic outbreak or eventually become a pandemic, such as swine influenza H1N1 in pigs in 2009 and COVID-19. So we really need to spend some time to try to understand the ecosystem, ecology, and also how humans interact with these animals. Right. Now, this is another example showing the H5N1 activities since October 2024. Now, you can see that it's pretty much everywhere. I mean, I just would like to highlight that you can even find H5N1 in South Pole. So the risk is here. We just don't know when the bomb will able to expose. We just don't know. I mean, to be honest, even I work on flu for the past 25 years. I cannot tell, but we know the risk. And we need to try to address it directly. Well, I mean, so now the question is, there are people saying, this is something that we cannot do much. We cannot able to fix it. But this is not too positive. I think we should try to take a proactive measures to try to identify the risk and able to do something to control it. So I told you before, Hong Kong has been identified the H5N1 human case for the first time in 1997. So after that, the Hong Kong government actually made a lot of effort to prevent the risk, right? I mean, so this is something that Hong Kong U and the Hong Kong government have been doing, collaborating with each other for past 20 years. So we basically involved in doing H5 or influenza surveillance in poultry for the past 2 decades. And try to identify the supply chain, explain and identify the risks, and explain how these pathogens are being transmitted in this supply chain. So without going much into details, what I can tell you is we actually help the government to develop some policy, right? And then we also try to use real-time control measure, surveillance systems. So basically, we go to the market every week to try to assess the risk. So this is one thing that we have been doing since 1999, even now. I mean, this is an early study. So you can see the graph talk about isolation rates. Basically, it can tell you how many influenza viruses can be identified or isolated in poultry. So you can see that, and on the left-hand side, in early days, we found a lot of avian influenza virus, pretty much on H9N2 in this case. But after introducing new policy, you can see that the number actually gone down or even close to zero. So what I can tell you that we are still monitoring it, and we only occasionally can able to identify avian influenza virus in the community or in the poultry market. So that's why, I mean, what I'm saying is we need to work with the government hand in hand with trust, so that people and the governmental official can able to open it up to allow those experts can able to address the issue and understand it better, so that we can come up with some evidence-based control measures. Right. I mean, now this is only one of the examples, but in fact, in the past 20 years, together with the Hong Kong government, and we tried to come up with new control measures to mitigate the risk of H5N1 in farm, poultry market, or in wholesale market. So I'm not going to go through all these control measures, but these are all backed up by evidence through long-term systematic surveillance. Right, and then explain why even you heard about H5N1 in nearby region in China, Cambodia, Vietnam, but our Hong Kong H5N1 case basically was more than 20 years ago. So we did not have local H5N1 case for a long time. So that reflects the efficacy or effectiveness of these control measures, so that we can mitigate the risk. And this is something that I think is a good example to show how academic, public health practitioners and governmental officials can work together. Right, now the other good example is the SARS in 2003. At that time, we identified SARS in human, but then eventually we also showing that palm civet cat was the intermediate host of this particular virus. We do have a good evidence, genetic ones, and also epidemiological evidence to show them. At the end of the day, China government banned the selling of this palm civet cat in wet market, so that we can able to eliminate the source at that time. And that's why this is one of the reasons why we can control SARS at that time. Right, now, the other aspect which I think I learned a lot is about the developing a diagnostic test. This is very important, because without a proper test being used, you can't tell who are being infected or who are infectious. So without this information, we cannot come up with proper control measures to try to reduce the risk further. Now, one of the examples is the 2009, as I told you before, we work on infectious disease for more than 2 decades. So we experienced the 2009 pandemic at that time. At that time, I would say, I mean, we have some diagnostic tests, but we failed to implement it as extensively that we want at that time. At the end of the day, the number of cases is gone up so high, and people stopped to use the diagnostic test to identify the patient, so that we cannot able to control it in a proper way. And COVID-19 in 2020, I think we have a bare pass. The number of tests being used is much higher than the time in 2009. We, at least in Hong Kong, for the first 2 years, we test a lot of ourselves. I mean, RAT, rapid tests, and so on and so forth. We test it daily. If you only get 1 line, then you can go to work. If you have 2 lines, then you're able to have to quarantine yourself, right? So I think the technology is advancing, and then we can able to use it. So I think the problem next one is how we can disseminate it better. Right. I mean, I give you one example, how the advancement of technology can help us. So my lab has been actually a WHO reference lab for many years. So we developed a diagnostic assay, particular for flu and also coronavirus for many times. So I mean, in the past, when we have heard about SARS, H1N1, H7N9, we did develop the assay. We just share the protocol to WHO, and then so that the member country can able to use this protocol for testing themselves, their own citizens. But in year 2020, we go even further. We develop the test. We share this test only about a week after the first genome being released in the public. And not only that, we actually order the reagents. We share these reagents at a global level. So within a few weeks, by the end of April 2020, more than 170 labs in 77 countries received the reagent that we generated so that they can use it to identify their first COVID patients. So again, this is very important. And at that time, I can tell you you will receive many emails from industrial business or other diagnostic companies. They claim they have diagnostic tests, but these tests had never been evaluated properly. So for us, our duty is try to generate reliable tests that has been extensively evaluated internally before we disseminate this assay to our partners around the globe. So again, having some good reference lab and able to generate timely, reliable result or even diagnostic tool will be utmost important, even for the next pandemic. We need to identify these partners early. Right now, why is it so important? Now, right at the beginning of our January in 2020, we know that SARS-CoV-2 or COVID-19 patient is very different from SARS patients. So, I mean, by using this diagnostic assay that we developed, we immediately can tell that COVID patients, on the right side, we found a lot of viruses in this patient right at the beginning. So you can see that even at days -1. So that means that even the patient develops symptoms. They actually contain a lot of viruses in the body, and they feel free. They did not know they are sick. They did not know they are infectious. They walk in the community and giving them so many opportunities to share or shed these viruses and infect other individuals. Right. So unlike the COVID SARS patients, they are very infectious only in the second week of disease onset. So they are at that time they are very sick. They already has been hospitalized. Right now, the thing is, I think we already in the second month of the 2020, we already share our opinion in Nature Medicine, right? And just telling others, telling them that the control measures for SARS-1 in 2003 is unlikely to be effective, right, in controlling COVID-19 this time. And we already put this message upfront, but actually not really so many people listen to us. So now I think I keep on asking myself is, so who is actually listening to us, scientists, and how about the community? I mean, are we using the wrong channel to disseminate this finding or opinion, right? I mean, of course, for us as academics, it's good to publish and put a commentary in a scientific journal, but did the community actually willing to listen to us? I mean, how we can able to catch their attentions? And then the other thing is, at that time, the opinion was so diverse. There are people saying this is not infectious and we can control it. We can have an effective control measure to try to suppress the transmission and so on and so forth. Right now, so there are so many so-called experts in the community. I mean, how we can able to identify trustful expert who actually speak based on science, but not political view, right? Now, the other thing that I think we need to learn is now even if you have a diagnostic test, a good diagnostic test can be used in the community. So there are a lot of problems like testing strategies, right? Who should we test? Right, and how should we test them? So again, a lot of paperwork need to be done, like the ethics approval, standard protocol to try to evaluate the diagnostic test right at the beginning for the first few months. I mean, those who work in the diagnostic domain and keep on arguing. So how should we actually do a test, develop a test, evaluate the test? Are they actually good or bad, right? Where should we set the benchmark? So there are a lot of questions being asked and some of them being addressed, but some of them can't because we're just so unprepared, right? So this slide just basically I advocate for a careful designed plan so that we are ready for the future, right? If we have another pandemic or outbreak, how should we evaluate our assay in a proper manner, what are the testing strategies? Should we test individual level or community level? What is the frequency? Where should we actually take the sample? Do we allow self-sampling or what? Right? I mean, there are a lot of testing strategies need to be discussed and optimized. At least we should have some basic plan so that we can deviate from this plan, right? Rather than, everyone come up with their own control plan to try to evaluate, and then everyone say, yeah, my test is good. But in fact, they are not. Right now, so these are the things that I think this is very important in terms of diagnostic domain. So the technology which has to be used, all right, and then specificities, sensitivity, and so on and so forth, which I'm not going to go through all this, but these are all real problems that we've gone through at that time. And then every day we ask ourselves, and every week we actually have an internal meeting in the WHO to try to discuss how should we go forward. Right now, having a test in the community to be used is good, but then how we can implement it in the community. The other thing that I think we are very proud of in Hong Kong, we were one of the first to try to use wastewater to try to monitor COVID-19 activities. And this is something that as a public health practitioner, I highly recommend that because it is very cost effective, right? At least for COVID-19. Right, we should try to explore more options in using this approach to try to monitor other diseases. Right now, without going through too much, what we can do is basically try to collect wastewater sample in different catchment, and then try to detect whether this district or this building have any COVID-19 patients. So if we manage to identify a particular regions or a building that is positive for COVID, the government can introduce a testing policy to try to test all the residents in that particular building so that they can identify COVID patients and try to help them, right? Now, which is great because the testing strategy is so efficient that they can able to test all the individual at the evening and release the data overnight. So at 6 o'clock the day after, all the residents can do tests, they can be released to go to work, go to school, and so on and so forth without disrupting them so badly. So I think this is something which I think has a future for either for identifying patients or try to monitor the disease burden. Right now, the other thing that I learned from this particular COVID pandemic is about the usefulness of genomic surveillance. I mean, this is one of the protocol issued by WHO. I would not go through this one by one, but basically, I think genomic surveillance have a future. We learn a lot through the genomic sequencing, right? And but these are the problems that we need to address. So how we can able to assess those tools, right? How we can able to obtain robust and reliable result. How can we share the data? How do we develop better surveillance strategies? All right. And then once we have those information, how this information can inform the policymaker, and so that they can able to act in a timely manner. Right. So just give you some taste about the potential use of this genomic surveillance. These are the experience that we had in Hong Kong. So we managed to use genomic surveillance to showcase that people, if in an airplane, can transmit the disease in a very short period of time. In one of the example, we found 50 individuals in the same plane test positive for COVID, and we were testing the dynamic of these infections within the plane. Right, and then we also can able to show that the virus can transmit from human to pet and vice versa. And there was another study showing hamster can transmit the disease back to human. And the infection was possible, right? And one infected with ancestral virus, he or she can be still can be susceptible to be infected by Omicron. Now, I mean, of course, this is not new at the moment, but do remember that this study was conducted in 2020. Right. At that time, we know nothing about COVID-19. We know nothing about SARS-CoV-2. So these genomic surveillance give you new ideas and understand how this virus is being transmitted. The other example is that we managed to show that through this systematic genomic surveillance, we can You can actually tell how this virus is being introduced in Hong Kong and spread in a hospital, in a hotel, and then sequentially spread into the community. We can able to specifically tell how this virus is being transmitted from one place to another place. Now, I mean, these are all scientifically interesting, but what I want to make is, the point that I will make is, this finding can inform public health policy, right? So what kind of PPE, that personal protective equipment that you need to wear, pet management, vaccine usage, travel policy, testing strategies, and then also non-pharmaceutical control measures. So again, this information can able to allow policymakers or public health practitioners to build confidence about a certain policy, right? Like, why should we manage pet? I mean, if a general public criticizes, now we have data to back them up. Look, that is a problem here. I mean, we need to do something to control it. So it really helped to policymakers to try to build confidence on their own existing tool. Right now, the other thing that I think is also important now with big data analysis, modeling, advancement, and so on and so forth, we can able to use our sequencing data to try to estimate the disease burden in a community. I will not have time to go through the detail, but then during the Omicron wave, the 5th wave in Hong Kong, we actually lost count. We just don't know. We didn't know how many cases are actually found in Hong Kong. So, but using this genomic surveillance, we can do an estimation and tell that probably maybe about 50% of the Hong Kong citizens were affected by this Omicron wave, right? So again, and serologically also confirmed that our estimation is correct. So again, this genomic surveillance is the future. I mean, the question is, how should we do it? All right. Of course, at the beginning, everyone chipped in a lot of money. All the government give a lot of money to try to kickstart this program. But nowadays, many governments actually withdraw these resources, and quite a few countries actually stop doing this genomic surveillance. Now that become a problem. I mean, as a public health practitioner, what we advocate is we need a long-term systematic surveillance. It doesn't have to be, sequencing 100% of the cases, but some basal level is important because we can able to tell the trend. Is it going up, going down? Do we have a new variant? So this is something that all people should pay attention to. We are not asking for huge amount of resources, suck up all the resources to just address single issue, but some fraction of these resources to maintain this is important, because once we stop doing it, the expertise will left, and it's very hard to rebuild the pipeline, and it takes time to do so. Right now, the other thing that I think is also important, we need to try to assess the risk. So whenever we have a new variants, I'm talking about COVID-19 or maybe other other influenza viruses. So can we come up with some tool to understand the risk or predict whether this is harmful or not? Right now, so this is another example. Sorry, and we call it TIPRA. This is a tool to try to use different type of criteria. Basically, different expert will try to come up with mark. Say, for example, assess the virus property, host properties, ecology, and so on and so forth. These are the things that is too technical. I'm not going to go through that. But basically, this expert will tell, okay, if I'm encountering this situation, this is very risky, so give you a high score. And then for those which have less risky, we'll give a lower score. And then they will translate it into a matrix, so that we can able to do a risk assessment. Like, for example, we know that H7N9 is actually a much higher risk than the H1N1 or H9N2. So we can able to prioritize and try to do some ranking to identify those pathogens which have a higher risk to human, so that we can mobilize our resources to tackle these type of high-risk pathogens better. Right now, I just give you one example, right? We heard about MERS in Middle East, but you only basically know that MERS cases primarily found in Middle East, right? And of course, they flew to somewhere else inside, like South Korea, and caused a hospital outbreak. But the primary case primarily found in Middle East. However, I can tell you that actually the MERS virus can also be found in camel in Africa. There's a lot of African camels being infected by MERS. But now using genomic surveillance, we can tell that those viruses found in Africa actually genetically is slightly different from those found in Middle East. So again, that can, using genetic information, we may able to tell the difference. And of course, subsequently, we also do a lot of experimental characterization on these viruses and tell that those viruses found in Africa, they're actually not so capable in infecting in human cells, right? So again, there are some experimental tool to do some risk assessment. Right, now, I only have another 5 minutes. Okay, so now because of time, I just want to, go through other things like pharmaceutical interventions. Right, now, at that time, we don't know how this virus is being transmitted. Right, is it by direct contact, by shaking hands, and so forth, sneezing? So we developed some experimental model and confirmed that the virus can be transmitted by direct contact, aerosol, or by fomites. And again, with this information, we can tell that wearing masks, social distancing, and maintaining good hand hygiene is very good in preventing these transmissions. Right, now talking about fomite transmissions. And I don't know whether you heard about Diamond Princess case. This is the case that when they have COVID patients, and then basically all these customers, they actually stay in that cruise for a long time, and which is not good. Now, people again often ask us, now this particular room has been occupied by COVID patients. How should they disinfect this room? Are they still having, does it still having any infectious viral particle in the room? How should I clean it? So right at the beginning, we try to do some very simple tests to try to test the stability of the virus. So are they stable on a glass, wood, and so on and so forth? We just basically put viruses on different material and try to check the infectivity of this virus for a certain period of time. So again, this is a very simple study, but the community love it because they can identify the risk better. And at that period, we showed that basically some basic detergents, just like Clorox, can effectively disinfect the virus very effectively. So these are the information that the general public want, all right? And then we also come with the other control measures, like, at that time, for those who work in the hospital, there was a huge shortage of N95 masks. So we even come up with a protocol to try to show heat inactivations by putting this in the oven for a certain period of time. The virus can be inactivated, but without destroying the effectiveness of this N95 mask for filtering. Right, now, because of time, I just need to move very fast. Now, the other thing is we basically now try to understand how these pathogens being transmitted, right? So when you simply breathe or cough, sneeze, how much virus you basically emit from these activities. So our colleagues, Ben Cowling, basically have this interesting machine and convinced the patient enough to sitting there for 30 minutes. And then, and of course, there's a little video. They can able to watch the movie. Right, and then basically ask them to cough, sneeze, and then and try to measure the amount of viruses being emitted. In short, what we can tell is wearing a mask is good. You can able to stop the virus being transmitted, and then which is very useful for prevent the transmissions. Right, now, the other thing that we learn from this COVID-19 is amazing. I can tell you this is a very eye-opening study showing that human activities can even eliminate a particular pathogen. So all of us heard about influenza. There are two types of influenza, influenza A and influenza B. In fact, each of these have different subtypes. So influenza A, H1N1, H3N2, influenza B, Yamagata and Victoria. So after COVID, when people start to do social distancing, wearing a mask, now these are the influenza B, Yamagata. So basically, we found that it extinct. So these are H3N2, H1N1. So you can see that the virus is still circulating from year 2019 to year 2021. So it keep on spreading, and then of course the number is going down. But look at Yamagata. Basically, after at the beginning of the 2020, the circulation of Yamagata influenza B disappeared. And I can tell you that with our modulation of our behavior, that virus has been extinct, no longer being circulated in human. All right, of course, they are still being stored in some labs, all right, in feces. Right now, there's another measures. My colleagues, Ben Collins and our colleagues, basically try to come up with different control measures, epidemiological study to understand the effectiveness of different control measures. Right now, and try to relate it into the risk. So gathering limited to 1,000 of people or less, and the risk is here, and so on and so forth. Okay. So now using this epi data, we can able to identify the hot zone, so that we can able to come up with some control measures to control this high-risk area. Right, okay, so finally, the thing that I think the future is we need a better vaccines. So we need a better vaccine for flu, and we need a better vaccine for corona for two reasons. Number one is because the virus keep on changing. The vaccine that we have been using is not good enough. Vaccine mismatch, every year we need to vaccinate ourselves. That reflect the vaccine, our vaccine nowadays have some limitation. It's good, it's saving a lot of life, but we believe that we can do it better, right? So again, I don't have time, but what I would like to say is different parties actually come up with different control measures. So like CEPI, they have a 100-day missions. So they want to, try to come up with a platform. If there's a pandemic, they can make at least a prototype vaccine within 100 days. So that we can build on those to try to do a massive vaccinations. Right now, these ones are also something that which is related to my work, but I don't have time to talk about it now. But I think the vaccines is important. We need to build the next generation influenza vaccine now. But having a good vaccines, even a perfect one, is one issue. But how to use them is another issue. So this is the curve showing the number of COVID cases in Australia, in Hong Kong, during the Omicron wave. You can see that when Omicron came, both cities or countries, Hong Kong and New Zealand, the number of cases gone up substantially. But look at the mortality, the death rate. You can see that for New Zealand, there's no upsurge of the curve. However, in Hong Kong, there was a disaster. And that was because at that time, we do have a good vaccines. It saved life, but those elderly had a lack of confidence. Actually, they do not have confidence to be vaccinated. They are not convinced to be vaccinated, then create this problem. So now, developing a vaccine is one thing. How to implement this in the community, and how do you let the community trust on these vaccines? I mean, this is something that I think Hong Kong had a good lesson for that. Right, and then I think that what we need to do is try to identify the problem, why they do not, or they did not listen to us. See, is it safety issue, or political view, or something else? So I think there are many colleagues in Hong Kong actually doing this and try to identify different potential issue, and so that we can learn from them, and then so that we can able to come up with a better plan in the future. Right now, the other problem that we have here is infodemics. So misinformation, disinformation, malinformation. I'm sure you heard about this. I just don't understand why 5G can able to disseminate this virus in the community. So again, but people do believe it. Of course, I understand there are some people always want to believe something. They do not really listen to logic. But how we can able to do it better as a scientist? So I think this is something that it comes into mind all the time. We know that we are not saying we know everything, but then we know something. How we can disseminate this and convince other people, look, sometimes we have to accept this based on scientific evidence. Now, this is something that I like it. you can basically read it. Sometimes having a fact, having the correct answer, it doesn't matter. People actually do not want to listen to you. So how we can correct this issue, right? No, okay, so this is the last two slides. Basically, I think what I can share to you is basically coordination of collaboration and action plan is highly important. So you cannot work alone. How we can implement them, and then is one thing, how we can include most of the people, most of the stakeholders, so that they feel they are part of the game. And everyone can able to put their own effort to try to complete or accomplish the task, right? And then also sustainable support is important. At the beginning, there are people, the donor government keep in a lot of money. It's good, but how about in a few years' time? These people will disappear and this team will disappear. How we can able to address the pandemic down in the road? Data sharing, evaluations, having a transparent system is important. I would not go through this further, but inequity and governance failure, also, I would say they should take part of the responsibility for the COVID-19 pandemic. Right now, this is one of my favorite models. So we are all different. We are working in different disciplines, but we can work together. We come up with, we call it cheese model. Everyone come up with their own control measures so that we can build a better system. At the end of the day, the pathogens will unlikely be able to pass through all this barrier and infect the human. So it could be journalism, social science, basic scientists, policymaker. We all can contribute to these big global issues. Right, so for me, I am a scientist. What we treasure is try to translate our scientific findings to public health impact, to control these pathogens, right? So these are the key points that I highlight: One Health, early detections, equity, next generation vaccines, misinformation, and health system resilience. Resilient is important, right? Now, this is my own experience through this pandemic. Identify the problem, narrow down the scope to an adjustable ones. Many people come up with big idea, big questions, but it will take 10 years or maybe even more to address this problem. It's too late. People are dying. How we can able to address it? So I think something which is manageable, a small step forward is better than having nothing, all right? And then I also talk to and engage stakeholder. This is so important. Also outreach decision maker early and also the advisor, so that they can able to realize, hey, maybe this group of people can contribute. They may do something. I mean, whether they are doing it correctly or not, let's worry about it later. At least we know there are people who are willing to support this activity. Right, okay, importance of network, appreciate one strength and limitations. We are all human. We only know something, but not everything. But work together, by work together, we can able to address bigger issues, right? Provide realistic options and solutions. Okay, we don't need a blue sky project in a pandemic situation, okay? And by be vigilant and accept the fact that we do not live in a perfect world. We don't have a perfect answer for everyone. And answers should be available in a timely manner. And most importantly, we should build the trust between parties, between stakeholders, so that we can be very transparent and able to review the real problem, and so that we can able to take a more positive attitude to address the issue, all right? To me, I mean, this pandemic is not a pure scientific research. It's basically involvement of all the communities at all levels, all stakeholders, how we can able to work together. Academics, government, hospital network, international organization, journalists, local funding agents, airports, and all this. Basically, it affects all walks of life. Everyone can be chipped in their own resources and able to address this problem better. Okay, so at the end of the day, I would like to thank my colleagues in Hong Kong U and other institutions. Because of time, I just would like to just show this slide to all of you and then just thank for their contribution to address this pandemic and then also able to share this data among colleagues. Thank you.